This is the 2018 in-service law enforcement training for bloodborne pathogens. This class is going to take about an hour, and it's going to be your training for the year for bloodborne pathogens. It's not an awful lot different from the classes we've had in the past. It's been updated slightly. At the end of the class, we're also going to go outside the lesson plan just a little bit, and we're going to talk about some of our policies and procedures in case somebody does get exposed. Sergeants, corporals, lieutenants, this is the kind of thing that you do need to be aware of if you have an employee who gets exposed at 2 o'clock in the morning. There are some things that you may have to do on the scene right away in order to make sure that your employee gets the treatment they need. So I do ask everybody to pay close attention to that. Training objectives for this class, the first one is to relate the purpose of the bloodborne pathogen standard in OSHA 29 CFR 1920.1030, characterize the general symptoms and epidemiology of bloodborne diseases, distinguish the modes of transmission for bloodborne pathogens, and also to recognize tasks and other activities which may involve exposure to blood or other potentially infectious materials, demonstrate methods which prevent or reduce exposure to blood or other potentially infectious materials, and illustrate the appropriate selection, storage, use, and disposal of personal protective equipment. We'll also go over the components of the bloodborne exposure control plan to include appropriate actions and persons to contact in an emergency involving blood, procedure to follow if an exposure incident occurs, and information on post-exposure evaluation and follow-up. Just so you know, our policy and our general orders did get revised in 2017, so there are some differences about that. There are also some legal avenues that we have now that we haven't had in the past that will allow us to keep somebody in custody for a period of time if we need to while there's testing. So, jumping right into it, the bloodborne pathogen standard 29 CFR 1920.1030. This is the federal regulation that governs everything we do in terms of law enforcement officers and any exposure to bloodborne pathogens. Like any federal regulation, the very first thing that you have to cover is the definitions that are in the statute. And the first one is a bloodborne pathogen. What is a bloodborne pathogen? Essentially, it's any sort of a virus or infectious agent which may be carried by the blood. There's another abbreviation or acronym that you need to know, and that's OPIM, and that's other potentially infected material. That could be any other body fluid from urine to saliva to tears, which may or may not carry any sort of a bloodborne pathogen. The third thing that we need to talk about is what exactly an exposure is. According to the law, an exposure is non-intact skin, eye, mouth, mucous membrane, or under the skin contact. And that's what constitutes an exposure under federal law. When we talk about exposure control, we basically talk about 2 or 3 different things. The first one is an administrative control, and this is the way we reduce the chance that you're going to get exposed to something at work. Administrative controls are things like vaccination, preventive procedures, training programs, things of that nature. The second one are engineering controls. Engineering controls are physical barriers and hand-eye washing stations. They're any kind of device that helps reduce the chance that you might get exposed to something. And then the third thing that we're going to talk about is work practice controls. And work practice controls are the actual procedures and things you do on a day-to-day basis to make sure that you don't get exposed to any type of bloodborne pathogen or other potentially infectious material. Symptoms and epidemiology of these diseases are kind of important because it gives you an idea of what you may or may not be dealing with. We're going to talk about a couple of different things. We're going to talk about hepatitis B, we're going to talk about hepatitis C, we're going to talk about HIV, and we're also going to talk about MRSA, or methicillin-resistant Staphylococcus aureus, MRSA. The first one of these is the hepatitis B. Hepatitis B is a virus. It's caused by the hepatitis B virus, and it's got sort of a distinct list of symptoms. Those are jaundice, fatigue, fever, loss of appetite, nausea, vomiting, abdominal and or joint pain. When you look at this list of symptoms, the thing that is, I think, most striking about this is that all of these symptoms are very, very nonspecific. Fatigue, fever, nausea, vomiting, that can be anything from a bad cold to the flu. Nausea, vomiting could be food poisoning. It's really hard to say that this is hepatitis. There's one up there, though, that's very distinct, and that is jaundice. Jaundice is a very distinctive yellowing of the skin that you get from the inability of your liver to process toxins out of the blood. Yellowing of the skin can be a little bit difficult to see at times. Different people have different skin tones. It's hard to tell if the color of their skin tone is something that's always been that way, or if this is something new. The best way to tell if somebody has got any type of jaundice to them is to look at their eyes. If the whites of a person's eyes appear yellow, then there's a possibility it may be jaundice, and you may be dealing with a person who has hepatitis. That's not 100%. That's just something to remember. There are other diseases that also cause jaundice, but jaundice is distinct to any type of liver problem or liver failure. Hepatitis B is not something that we worry about an awful lot. Since 1983, there's been a drive to make sure that all healthcare workers or all people who may be exposed to any sort of bloodborne pathogen get the hepatitis B vaccination. Everybody who watches this class should have had a series of 3 vaccinations. Those 3 vaccinations give you basically 99.999% immunity to hepatitis B. You simply are not going to get it if you've had all 3 of the vaccines. I know that in the past there have been issues with people who've gotten 1 of the vaccines, they've gotten maybe 2 of them, but they haven't gotten the entire set of 3. If you have not had those sets of 3, contact your supervisor. They will get in touch with either Tracy Massey or possibly Corvell. I think it would probably be Corvell. And they can set you up to get those entire sets of hepatitis B vaccines. It's really important that you get that. You wear your vest to work every day, or you should if you're on patrol. There's absolutely no reason for you not to get all of those vaccinations. That'll keep you as safe as your vest will. There's another type of hepatitis C that's out, or hepatitis that's out there, and that's a hepatitis C virus. There's not as much known about the hepatitis C virus. The symptoms are similar to those of hepatitis B. People can be infected for years or for decades and have no symptoms of it, but they will be carriers of it. Statistically, there are a couple of things that we know, and that is that military veterans seem to be at high risk for hepatitis C. Vietnam vets in particular are at high risk for hepatitis C. They can be dormant for more than 20 years. Multiple blood transfusions will put you at high risk for it. Tattoos put you at high risk for it. The more medical contact you have, paramedics, EMTs, firefighters, first responders, that puts you at higher risk for hepatitis C. One of the things that has happened within the last couple of years is that so many people have become positive for hepatitis C, and it's felt that they've had the hepatitis C for, like I said, possibly decades, that a hepatitis C test is now becoming routine for most people who are over the age of about 45. So if you are a baby boomer or on the tail end of the baby boomer group, then don't be surprised if your doctor during the course of your regular physical asks you if you've had a hepatitis C test and recommends that you take one. One of the other things about hepatitis C is that it's kind of hard to believe, but there have been a number of outbreaks within the U.S. of hepatitis C, and they're largely related to poor infection control practices. They've occurred mainly in some of the ambulatory care clinics, some of the free dental clinics, the dialysis centers. There have been a couple of large outbreaks of this. One of them in particular was in Buffalo at the Veterans Administration Center, the VA hospital. And one of the things that happened is that they were reusing the insulin pens from one patient to another. It's hard to believe, but what they were doing is that they were actually reusing the insulin pen, which is like a syringe, from one person to another. Just within our own little corner of the world, there was a nursing home in Chapel Hill that had an outbreak of hepatitis C because they were not cleaning the glucometers, the little finger stick things where you check a blood sugar, and they were passing hepatitis C from one patient to another. I think ultimately 2, possibly 3 persons ended up dying from that particular outbreak. So this is something that does happen, and the reason that I bring this up is that whenever you go to the doctor, whenever you go to the hospital, if you've got any concern about what anybody is doing to take care of you, you've got every right in the world to question your healthcare provider and make sure that they're using appropriate infection control processes on you. If somebody is trying to give you an injection of any kind or a vaccine, you've got every right to make sure that your provider washes their hands, and also you've got every right to make sure that they're using clean medical devices on you. So one of the good things about hepatitis C is that there are various tests for it that are really, really quick. The good thing about this is that if you do get exposed to something, we can find out very, very quickly whether or not the person to whom you've been exposed has gotten any kind of an infectious disease, and then take appropriate action. Hepatitis C has got a good prognosis if you start treating a person early enough. And these tests are very accurate, they're very quick, they're not incredibly expensive, and so it's important to make sure that you do get exposed, you start the paperwork on this so that we can test the person to whom you've been exposed. You can get the treatment if needed. Hepatitis C, up until a few years ago, basically there was no medical treatment for it once you had it. As it stands right now, you can get treatment for hepatitis C. It will cure hepatitis C, but it is very, very, very expensive. I think the 6-month program runs about $75,000 for 6 months. So it's much better to get the early treatment, which is considerably less and costs considerably less. The other thing that we are going to talk about is HIV. And HIV is the human immunodeficiency virus. And of course, this is a virus that causes AIDS. This has been around for decades at this point, and HIV infections and AIDS infections are characterized by a couple of different things. They're characterized by night sweats, by weight loss, fever, fatigue, muscle pain, joint pain. Many of the people who've got HIV or AIDS infections end up with some really nasty, difficult to treat pneumonia-type diseases. And that's one of the classic signs of HIV is people with pneumonias that do not go away. Over the years, there has been a huge amount of concern about HIV and the possibility that people would contract HIV on the job. From 1978 to 2010, there have been a total of 57 documented cases in which healthcare workers contracted HIV from on-the-job exposures. 49 of those were sharps-related exposures, in other words, needle sticks. There has never been a law enforcement officer who has contracted HIV from an on-the-job exposure. There is one corrections officer who was in a federal facility. This corrections officer was trying to hold pressure on a arterial bleed of a dialysis patient who was HIV positive. He was doing so with his bare, ungloved hands, and this was a gentleman who also worked as a brick mason. So his hands were completely torn up from handling bricks and cement, and that's how he managed to get an exposure. You know, I don't think that anybody who works for the sheriff's office is going to do anything like that. I certainly would hope not. The fact of the matter is that HIV is one of the lesser things that we need to be concerned about. The good news is that there have been no new cases of any healthcare worker, any firefighter, any EMS worker, anybody like that who has gotten an HIV exposure and a positive HIV conversion since 2001. A couple of updates about HIV. A large number of the people who take the HIV drugs are unable to transmit the disease because their viral load is so low. A large number of the people who are HIV positive are now living 50+ years after the date in which they were diagnosed as being positive. Just to give you a little